you guys both mentioned how rare allergic reactions are with these vaccines, and putting them in context with other things like penicillin. What would you say to someone that says, well, that's fine, it's only 1 in 100,000 or so that get an allergic reaction, but I don't know about long-term side effects with these vaccines. And I also, I take really good care of myself. I have a strong immune system. I don't get sick often. Why should I get the vaccine? If I get sick with COVID-19, I'll just let my own immune system fight it off. What would you say to that question? I'll start with you, Dr. Campbell, on this one.
Well, you just never know if you're the one that's going to get sick. I've met so many people who said, well, I don't know why this happened to me, but it does. That's the nature of disease. It does happen to people. And although we have recognized comorbidities, increasing severity with age, increasing severity with other comorbidities, that's on a population level. If I get infected, although I've no particular comorbidities, I don't know if it's going to kill me or not. There's always that possibility. We can't predict all of these things. And it's this risk-benefit analysis again, isn't it? I'm pretty happy with the safety of the vaccines. I'm more than happy to get that. I don't really want to get this disease because there's maybe a 2% chance, 3% chance it's going to kill me. That chance is always there. And as well as that, the thing with the vaccine is, even if you could guarantee, which of course you never can, if you could guarantee I'm going to be safe, am I going to pass it on to other people? There's this social responsibility. So vaccines for me are just this win-win situation. It protects me, which I'm pretty happy about, but it also protects those around me and contributes towards herd immunity. So it's a win-win situation. I'm so jealous of Roger having had his. I really am. I haven't had mine yet. I'm really looking forward to it.
Anything
well, I hope you get it soon. I'm supposed to be getting my second shot later this week, and I heard the second shot's a little worse, so we'll see how it goes.
It kind of makes sense because you've already developed some immunity to that, and then when you introduce the antigen again, you're going to get more of an inflammatory reaction, and as you know, the inflammatory reaction can be localized, but you also get this systemic inflammatory reaction, which is what makes you feel bad. Right. So, but, okay, you need to book a day off work, and just take it easy for a day or two after the vaccine. That is a price well worth paying.
Yeah, I agree.
For not getting this disease, taking away the risk of dying and taking away you as someone who could potentially spread it to someone else. To me, it's a small price to pay, and I'm more than happy to pay it.
Yeah, Kyle, I totally agree with John's assessment there of that question. I don't really have much to add. Absolutely the same points.
Another potential consequence of COVID-19, Dr. Campbell, you mentioned the risk of course, dying or having a severe infection. Another potential risk is this long COVID syndrome or long haulers. And so I'm curious what both of your thoughts are about that. Certainly people that have experienced that some of them have been very vocal. We need more recognition for this and more awareness around the post-COVID infection effect. So I'll start with you, Dr. Seheult, just general thoughts on that.
Well, they're absolutely right. We do need more, and we are getting more information because as this pandemic goes on, that information is going to come in. A lot of people see this as a black and white issue. You're either dead or you're not. And unfortunately, it's not that way. It's a gradient. There are people who've survived it, who are alive, and yet are experiencing daily debilitating symptoms. You're choosing between, in a pandemic, having the post-viral effects of getting the virus versus the post effects of getting the vaccine.
And I know which I'd choose. I'd go with the vaccine risk rather than the infection risk, that is for sure. No, I agree completely. The idea that something's going to drop out of the ceiling in 18 months' time and hit us when we weren't expecting it, I think the chances of that are pretty close to zero.
And to your point, Dr. Seheult, I think it's important to also point out some of these complications or side effects that arise during a vaccine trial, like Guillain-Barré syndrome, which is a scary thing. It's a nerve syndrome where there's a temporary paralysis potentially or worse. But the importance of comparing that to also background. How many people experience something like that, Guillain-Barré or Bell's palsy, without a vaccine or with a typical infection? So I think that's something, again, from my vantage point, that's lost with media reports. It's like, hey, look, this person was in the the vaccine arm of a trial and they got this Bell's palsy, this facial paralysis. But turns out there's a proportion of people that get that regardless. That's that, we call that background. And sometimes that's lost in these news reports.
We had this with the MMR a few years ago in the UK. People were saying there was autism after the measles, mumps, rubella vaccine. And there was a report on the news where a child had the MMR vaccine. They went to visit him next month and he developed autism. They took one case completely out of context. It turns out there is no correlation here at all. This was completely bogus science. And for example, in the Oxford vaccine, when they were doing the trials in Brazil, there was actually 3 deaths from trauma. There was one person was actually murdered, one died in a road traffic accident, and one died from blunt trauma to the head. And of course, that's nothing to do with the vaccine at all. It's just, if you're taking large numbers of people, that then things can happen. Living human life is dangerous. It's not risk-free.